The following podcast is about obsessive-compulsive disorder. It was created by Aoife White, a final-year undergraduate psychology student at the University of Limerick in October 2015. Obsessive-compulsive disorder, or OCD, is an anxiety disorder characterized by repetitive obsessions and compulsions. What are obsessions? Obsessions are persistent thoughts, impulses, or images that feel uncontrollable and intrusive. A person with OCD may feel unable to ignore these thoughts. An example of an obsession might be a nagging need to check whether a tap was left running, or a recurring image of a loved one being harmed. Obsessions are linked to compulsions. What are compulsions? Compulsions are repetitive behaviours or mental acts. Compulsions may be carried out because a person feels an irresistible urge to do so, or to reduce the anxiety brought on by obsessions. However, the action may not have a realistic connection to the obsessive thought. For example, a person may feel a need to check if a tap is running to calm themselves after a strong doubt about it, and may need to check it several times in a short period. Or, a person may feel a need to count the number of words in every sentence they speak to get rid of thoughts about harming a loved one. Checking a tap is an overt compulsion, which is an action noticeable by others. Counting the number of words you speak, however, is a covert compulsion, which means it is an internal mental act not visible by other people. What is the cause of OCD? It's not known for certain. However, there are many different theories about what might cause OCD. I'm going to focus on a cognitive approach, involving executive function, cognitive flexibility, and categorization. Executive function refers to the control of the mind's processes. This includes the ability to solve unique problems, sustain attention, and cognitive flexibility. Cognitive flexibility is the ability to switch between thinking about two different ideas and the ability to think about multiple concepts at the same time. For example, one measure of cognitive flexibility is called the Stroop task. For this test, words are shown on a screen in coloured font, and the person participating in the task is asked to read the colour written on the screen. People often get confused by the colour of the font if it is different to the word. Psychologists Clayton, Richards, and Edwards found that people with OCD find this particularly difficult, as their executive function is impaired. Additionally, a psychologist called Reid put forward a theory in 1985 which suggested that people with OCD may find it difficult to structure their experiences, and may make and enforce mental rules and boundaries to make up for this lack of structure. People with OCD may have a difficulty making decisions about category membership, and be less likely to include things in existing categories. A study carried out by psychologists Persons and Foa found that people with OCD took longer to sort cards into categories, created more categories for cards, and took even longer for cards related to their OCD obsessions. These findings support the idea that OCD may be related to poorer categorization abilities and impaired cognitive flexibility. What are the treatment options for OCD? Well, some medications have been shown to help people with OCD. There is also cognitive behavioural treatment, which is based on the cognitive approach to OCD. Cognitive behavioural treatment involves challenging the way people think about their obsessions, acknowledging that everyone has intrusive thoughts, and learning how to change thought patterns. A study by a team of psychologists in 2006 found that the cognitive flexibility of people with OCD was improved by several weeks of cognitive behavioural treatment. This means that people with OCD can learn to manage the disorder with treatment. In summary, OCD is an anxiety disorder characterized by persistent intrusive thoughts called obsessions and repetitive behaviours or mental acts called compulsions. The cause of OCD is not certain, but one method of understanding it is the cognitive approach. According to this, people with OCD experience impaired executive function and may find some tasks which require lots of cognitive flexibility more difficult. However, psychologists have found that cognitive flexibility can be improved with cognitive behavioural treatment, which can help OCD patients manage their disorder. This podcast is not detailed enough for any kind of diagnosis. If you have any concerns about your mental health, the best thing to do is to speak to your GP, who will be able to help you. You can also visit one of these websites for more information. Thank you for listening.
Created using Powtoon.